drugged.
That's good, right?
Yeah.
How you feeling?
My chest kind of burns a little bit.
Are you nauseated?
No, but it's like
Are you happy?
I'm still too drugged. It's like it feels like it's kind of harder to breathe a little bit. I mean, they said I'm fine, but like it almost feels like my throat's kind of constricted.
Really?
Like
I wonder if it has to do with the general anesthesia, because they put a tube down your throat.
Yeah, I think that's what it's from. Like it feels like I'm gonna start snoring in a minute.
Have you had anything to drink yet? Will they let you have anything yet? Okay. Well, you can just relax if you want. They just let me come back and...
Yeah, they asked me if I wanted you to come back, and I was like, psh, yeah.
Dr. Garramone came out and talked to me.
Did he?
Yeah, he was really nice. He came out and walked right to me and said everything went great, everything went well, nothing weird, just everything was perfect. And, you know, just everything's set, and then we'll see him on the 10th.
Sounds pretty bueno.
Yeah.
Although, do you feel still rather drugged?
Yeah.
Like, I don't feel like I could go to sleep.
Yeah.
And my nose itches.
Do you want me to itch it?
Well, it's more an internal.
It's because you have that nasal cannula.
Yeah, like I just want to like...
Arr.
Yeah.
Get it?
Yeah. For sure.
Alright, we're on.
Okay. Hello. Today, well, I guess it's technically tomorrow from surgery day, the next day after. It's like 1 o'clock in the morning. And surgery went really well today. The pre-op appointment yesterday, really it was just a matter of like filling out paperwork, and then Dr. Garramone kind of like he took some pictures and showed me what his battle plan was for my chest and how kind of tried to give me an idea of how it might look after the fact. And what else? That was pretty much it for the
It's kind of like post-op stuff.
Yeah, kind of giving me an idea of what I could expect at the surgery center and then what to do after. And Lindsay came with me to that appointment, so it was good to have her there to kind of have two people to listen and pay attention to what needed to happen and stuff. So yeah, my surgery was at noon, so I had to be there at 10:30, and same kind of thing. I had to fill out just a little bit of paperwork, just sign a few things, and then waited in a waiting room for a while, and then they took me back. I thought I was going to be coming back out, but they were just going to take me back and get me ready to go, so I had to just strip down to just underwear and socks and put a gown on, and then they brought me a bed, lay in the bed, hang out a while, and the anesthesiologist comes over and explains what's going to happen and asks a bunch of questions. And a nurse put in my IV, which wasn't so bad. She was very good at what she did. One attempt, it went well. Yeah, and I don't really remember much beyond being wheeled down the hallway on the way to the OR. I remember going down the hallway, but I don't really remember arriving in the room or anything. The next thing I remember was just waking up or trying to wake up in recovery. It's like really hard to wake up and open my eyes and stuff, and after a while they let Lindsay come back, and so yeah, I I was a little bit nauseous at first, but I told the nurse that, and she gave me some medicine for that, so I felt better. And yeah, just kind of hung out long enough until I felt good enough to walk out to the car, and it's just been a lot of laying around today, trying to take it easy. I'm taking Vicodin every like 4 hours now. I didn't for a while at first, but I was having some pain kind of in like the middle area, like in my sternum area where I think the incisions probably are. So, but the medicine's helping. It does make me a little loopy, but it's all good. Oh, blowing up. So, I'm gonna show what the bandages look like, and there are drains attached, and they have blood in them. So if you don't want to see that, then you should probably stop watching at this point. But for those of you who do want to see it, here it is. Alright. So, it's wrapped very tight. So it's, I have to be kind of hunched over. Like I can't really sit up any more straight than this. So, bandage, this all stays on until Lindsay's girlfriend, she's very insistent sometimes. Hi, Ashley. Yeah, so we've only emptied the drains. I guess we've done it twice, huh?
Yeah, the first time
post-op was still at the surgical center. And they showed Lindsay how to do it, and then we've done it once here. And they're doing pretty good. I mean, they said we could have to do it as often as every couple hours, but it's been what, at least 3 hours since we did it? Or
yeah.
something. So anyway, that's pretty good. But it's hard to take a good deep breath. Like, my breathing's pretty shallow, but it's manageable. It's kind of hard to get comfortable. It's kind of my only hang up at the moment, but I have a mountain of pillows, because I have to sleep,
I think
propped
6.
up. Yeah, I think 6 plus a like throw pillow, which I hope my face doesn't touch, because it probably hasn't been washed in 33 years. So anyway, that's yeah, surgery day done, and hopefully I'll be feeling up to updating for day 1 post-op. So have a lovely night.